So a couple of questions. First is, how can we recognize the coronavirus versus the common flu? And right off the bat, not a lot of differences, but some things that might tip you off one versus the other. For the COVID-19 or coronavirus, you're most likely going to have a fever, you're going to have a cough, and you'll often experience shortness of breath or difficulty breathing. For regular influenza, you're going to often have a fever or feel feverish where you have hot streaks and chills, a cough, but then you also usually develop the characteristic sore throat, runny nose, muscle and body aches, headaches. Oftentimes you're extremely tired. In children, vomiting and diarrhea is very common, but not in adults. So the easiest way to do it is to quarantine yourself and then contact your primary care physician to see if they want you to come in and get tested. If a person is suspected or presumed to have the coronavirus or any respiratory-based illness, isolate the individual from others and self-quarantine the caregivers as well. Identify those parties at risk from previous contact with the presumed individual, and that's what the Department of Health and the state is doing, is trying to go back and track where these individuals have been and see who they could have been in contact with. Monitor those who have been exposed and potentially self-quarantine them, and then contact the local primary care physician or the health department if they want them to come in to be tested. So what can we do to prevent the spread? And really it's very simple. It's just good infection control techniques like we've all learned throughout our lives. Stay home when you're sick, especially if you have a respiratory disease symptoms. So if you're sick, please stay home. Cover coughs and sneezes with a tissue, then throw that tissue in the trash can appropriately. Wash your hands often with soap and water for at least 20 seconds. Can't emphasize that enough, as good hand washing techniques go a long way. If soap and water are not available, then by all means use an alcohol-based hand sanitizer with between 60 and 95% alcohol content. There are various different ones out there, but that's the safest one to use. Routinely clean frequently touched surfaces and objects. Things that we think about all the time, cell phones. So clean your cell phone cover and the screen and everything like that on a regular basis. And the other thing that gets a lot of attention is the TV remote. Clean that as well. So some things to think about are things that we touch all the time and deal with. You can use the appropriate disinfectants that you can find for mild enough to use on your cell phones and your remotes and everything like that. One of the things that I've done when I've gone on travel is take the remote and stick it into a sandwich bag and lock it up. You can still have the raised buttons and use it, but you're not actually touching the device itself if you don't know where it's been. Pay attention to the CDC travel advisories. They change on a regular basis. They've changed today. And suspend any non-essential travel to destinations where the risk of transmission is high. And the travel notices are posted, and we'll talk about this several times here, on www.cdc.gov. And then review your own preparedness. What are you doing in the workplace? What are you doing in your own families? Make sure you have the proper supplies at home. Do you have a thermometer that you can check your temperature with? Do you have cold medicines? Do you have pain relievers? Do you have soap or an alcohol-based hand sanitizer? What about water or any type of fluids that have electrolytes in them? And then have a plan for childcare. If you're sick, you're going to need to have someone take care of your kids if you have children. Ask your employer about sick leave and any telecommuting policies that you may have if telecommuting or telework is available to you. And the other thing you can do is sign up for a Fredericksburg Alert at www.fredericksburgalert.com. So let's talk a little bit about what the city has already done. Back on January 23rd, 2020, when the information came out about the COVID-19, or back then it was called the coronavirus, and it started out in Asia, in the Wuhan section of China, we started looking at potential problems with travel. So we alerted our 911 dispatchers to start asking questions for anybody that had flu-like symptoms if they had any type of travel in their past, whether it had been 2 weeks, a month, anything like that, to try to get ahead of this situation to see if we had any potential there. We're stepping up our efforts with our fire, EMS, and police that are responding to potential patients with experiencing flu-like symptoms. We've now increased that to use surgical masks and things like that, not only for the patient but for our providers as well, just as potential protection for anybody that's experiencing flu-like symptoms. We're also got in position to decontaminate vehicles. We've got substances that can decontaminate vehicles and airing them out and getting the proper air exchanges in the vehicles. We have ordered N95 particulate masks as well as cartridges for our P100 masks that we now have that are effective against droplet exposure if we end up having those types of problems. We're also stocking up on surgical masks. Again, because of the situation and the situation that is going about, those particular products are in high demand, so we have a little bit of a back order, but we do have enough in stock right now to handle our current needs. Public Facilities is using a two-step approach for cleaning all touchable surfaces. That includes restroom surfaces, door handles, handrails, light switches. Step one is a complete clean of the surface with any CDC-approved product that's effective. Some of those products may or may not have bleach in them. And then step two is completely spray the touchable surfaces with the CDC-approved disinfectants, let it sit for a while, and then wipe everything dry. We have been in touch with the city schools and working with their leadership to develop a plan. They are working in conjunction with the other area school districts, so if there becomes an issue with an outbreak in the future, they know what to do as far as numbers of students or pupils and how many it needs before they decide to cancel classes or go into a particular mode that they're working with. And we're working with them and keeping them updated, and they're doing the same with us. If city personnel become sick, they need to notify their supervisor and stay home until the illness is passed. How do we know that? That would be 24 hours after no fever without the use of fever reducers or relievers. If they still have a cough, they should consult their primary care physician before returning to work. If a person is known to be sick in your office, have the various service wiped down with the products that kill the standard coronavirus, or use a bleach solution or what can be provided by city staff. Work with the personnel from Public Works and Public Facilities to get that done. The services include doorknobs, handles, surfaces your hands touch often, computer keyboards, mouses, and cell phones. We may eventually, but we're not to this point, practice, if we have enough people with the disease found, to practice social distancing and looking at the potential for telework, although that would probably only be for essential employees that have those capabilities. We cannot emphasize enough that the risk to the general public is still considered low by the CDC and by the Virginia Department of Health. Practicing good hand washing techniques and common sense exposure limiting practices are still the best options for everyone. As the monitoring of individuals who tested positive for the disease continues to occur, the medical community will get a better idea of how this disease is spread and the best practices to prevent the spread and contamination of the problem, and they'll update us as they go forward. So how can the public stay up to date on the situations and the changes in the conditions? We've created a page on our website for the city government related to the COVID-19. For example, in case there is a change in services, it will be posted on this website. It can be found by visiting fredericksburgva.gov and looking for it on the homepage. Citizens who wish to receive an email or text if there are updates on this page are encouraged to subscribe to our news flash list titled Fredericksburg News. Fredericksburgalert.com is our primary method of delivering timely alerts. Residents are encouraged to subscribe to Fredericksburgalert.com and look for the list located under General Community Information and City Government Closings. Anyone who has questions about subscribing to our alerts is encouraged to call the City Manager's office at 540-372-1010 for assistance. Area news outlets. Additionally, city communications staff will be sending critical information through local government access channels. That's Cox Channel 84 and Verizon Channel 42 to our local radio stations and newspapers, and on our Fredericksburg Gov social media account on Facebook, Twitter, and Instagram. You can also access the Center for Disease Control and Prevention online at www.cdc.gov/coronavirus/2019. Or you can get a hold of the Health Department's website at the Rappahannock Area Health District at www.vdh.virginia.gov/Rappahannock. I can't emphasize this enough. Misinformation that can be put out there can lead to fear and hostilities and some panic. We don't want that. We don't need that. We can fight this by putting out the correct information and the facts about the virus and what to do when you have a supposed exposure. If you have any questions, I'll be glad to answer, if I can.
Any questions for Chief Jones? Yes, Councilor Kelly.
Thank you, Madam Mayor. Thank you for the presentation, Deputy Chief Jones. Just one question right now, and that is, we had the Washington State scenario where you guys and the police department, the fire department, police department, you guys are on the front line of this because you will in all probability be the ones responding to these situations first. In that particular case, as a result of that, and they made protections, and I want to thank you for kind of explaining what our EMS and police personnel will be doing in these situations, which I think is appropriate. But they lost, what, 3 police and fire personnel who went into quarantine, and I would assume something like that for us would be an issue. Have we talked about or are talking about either through our mutual aid agreements or in-house about how we would potentially deal if we take any shortfalls with regards to EMS and police personnel?
We keep in contact with our partners in Stafford and Spotsylvania and in the region, trying to share information to make sure we have the most accurate information. You are correct that if we lose 5 or 6 people, it puts our shift down and compromises what we can do. We'll have to backfill as best we can or look to our partners to provide additional assistance. What we're trying to do is give our people, both the police, fire, and EMS, the best information available and to use the proper precautions. Right now, what we've been told by the Virginia Department of Health is that if we place a surgical mask on a person who is under investigation or we think has flu-like symptoms, we'll put a surgical mask on them and we'll use a surgical mask. At this point in time, what they've told us is the chances of spread of the virus or exposure are very low at this point. If it changes, then we will upgrade to the N95 masks, which we have in stock, or the cartridge masks, the P100s, which we have the cartridges for. And we also have in place various ways to decontaminate the back of the ambulance, and we can also move that to police cruisers if they would transport somebody that would be potentially an exposure in that situation. So we're doing that. That information has already been passed out to our staff. They've had that for almost 48 hours now, and we're continuing to move forward with that. And we try to make sure that our people stay updated every day on what's going on and whether there are changes related to the level of personal protective equipment that they need and should use. Getting air exchanges in the back of an enclosed environment, such as the back of an ambulance, are very important. And being able to use the power ventilator that we have in the back of the ambulance that exchanges that air is helpful, and also to kind of close that out, prevent it from going front to back. And when we arrive at the hospital, a lot of times we'll leave the rear doors open to facilitate those air exchanges. So by the time we finish our paperwork and we've transferred the patient over to hospital care, that we have enough air exchanges in back, we can go in with a gown and face shields and things like that and disinfect the back of the ambulance and then move forward. So we are looking at that. We're working with our partners regionally, and we're also following the CDC and the VDH guidelines.
I think you guys are doing a great job. You seem to be really prepared. It was an issue that came up, and especially, again, you guys, both police and fire department, are going to be critical in whatever happens in this situation. We want to make sure that you got everything covered, and it sounds like you do, and thank you very much.
Thank you.